السلام عليكم ورحمة الله وبركاته. أنا غسان باز، لبناني الجنسية. جئت إلى تركيا لأعمل فحوصات طبية. جئت إلى مستشفى ميديكال بوينت، وقد استقبلت من قبل الموظفين في ميديكال بوينت انترناشونال ديبارتمنت. استلموني وساعدوني في كل مراحل الفحوصات والعملية. كانت عمليتي هي عبارة عن استئصال للمثانة لوجود ورم سرطاني. قام الدكتور بفحصي، وكان هناك حلان. الحل الأول هو أن يعطوني علاجات كيميائية وإشعاعية، ولكن كان رأي الدكتور أن عنده حل آخر، وهو استئصال المثانة بالكامل، كون المرض هو عبارة عن سرطان من النوع الخبيث والشرس الذي قد ينتشر في الجسم بسرعة. فكان القرار صائبا، وقد تمت العملية إزالة المثانة. كانت العملية ناجحة جدا، وقد أزيلت المثانة. كانت الفريق الطبي خلال الأسبوع انتهينا من العملية، وأنا الآن بصحة جيدة وجاهز للخروج من المستشفى.
Dear patients, as with this patient who has come to us from Lebanon, bladder cancer is actually among the most common types of cancer worldwide. In particular, countries such as Turkey, Lebanon, Jordan, Malta and Belgium are considered to be among the leading countries in the world in terms of the prevalence and incidence of bladder cancer, that is, the rate at which it occurs. Bladder cancer presents itself in two forms. Firstly, superficial bladder cancer, and secondly, as in the case of our patient, bladder cancer that has invaded the deeper layers. Of course, bladder cancer that has spread to the deeper layers is a disease that is quite difficult to treat and manage, because after the surgical procedure you perform, the patient is obliged to continue their life with certain permanent symptoms. In cases where bladder cancer has spread to the muscle, that is, to the deeper layers, the main principle of approach can be summarized as the complete removal of the bladder and the construction of a new bladder in its place. Of course, in most cases around the world where a new bladder is constructed, the newly made bladder is connected to the patient's abdominal skin, and the patient is forced to live with a bag for the rest of their life. In cases like the one we performed for this patient, the new bladder, meaning the newly constructed organ, is connected to the patient's physiological, normal urinary tract, allowing them to urinate as before and continue their life without the need to carry any device or bag. No illness is hopeless. If you ever notice blood in your urine, this is a very important sign for bladder cancer, so never forget to consult your doctor. Bladder cancer is a treatable disease, and rest assured, your doctor will offer you one of these treatment alternatives. So, how does the newly constructed bladder work? From which part of the patient is the new bladder made? After the organ is completely removed, a section of the patient's own small intestine is used and shaped into a bladder. The urinary channels coming from the kidneys are reconnected to this new bladder, and then the new bladder is also reconnected to the physiological urinary tract, thus completing the procedure. Of course, it involves a hospital stay of about 7 to 10 days, and after being discharged, it is an operation that requires around 2 to 4 weeks of rest at home. However, I consider it a great opportunity for this group of patients to be able to urinate completely physiologically at the end of the treatment. I wish you all healthy days.